So having known the basics of fast, what do you mean by fast, and when the fast is done, and what are the next step if the fast comes out to be positive, let us see how fast is done. What are the different views of ultrasound that you're going to see, okay? So which of the following is not the view done in the routine fast protocol? Not the views they're asking, okay? Right upper quadrant, left upper quadrant, left parasagittal view for the lung, subxiphoid view, suprapubic view. Okay, I'll give you an image and then you will understand. These are the routine fast. You want to look for the solid organ injury, particularly you want to cover liver. Your main aim is to cover liver. Look at the spleen, have an idea about kidneys, look at the bladder region, okay, because there's a bladder injury, there could be bladder injury. So look at the bladder, okay. So these are the areas where there are potential sites of injury. So you always put your probes quickly at these 4 sites in the right upper quadrant. Right upper quadrant, that is your perihepatic view, that will give you the view of the liver, and this is also basically called as a Morrison's pouch view, because if there is a liver over here, there is a kidney over here, so this is the hepatorenal pouch or the Morrison's pouch. So keeping the probe here, you can see the liver, you can look at the right kidney, you can look at the hepatorenal pouch. So Morrison's pouch view, perihepatic view, right upper quadrant view. Then you keep your probe in the left upper quadrant, have a look at the spleen, there will be spleen lying over here, there is a left kidney lying over here, okay. So look at the view of this. So this is perisplenic view. Left upper quadrant view is also basically called as a perisplenic view. Then subxiphoid view, just place here in the subxiphoid view. This is also called the pericardial view, because you just place here and just tilt your probe. You will see if there is any pericardial effusion or not. Subxiphoid view, pericardial view. And then the suprapubic view, the pelvic view. Place it in the pelvic region, see for any bladder injury, see for any fluid in the pelvis. So suprapubic view or the pelvic view. These are the routine 4 views basically that are done in a routine fast. Understanding? So right upper quadrant, left upper quadrant, subxiphoid and suprapubic views. Left parasagittal view for the lungs. Remember the view for the lungs. We are not looking at the lungs in the routine fast scan. Lungs are seen in E-fast. I am going to teach you just further. Clear with this? So this is how a normal ultrasound looks like. This is basically your liver. This is the liver and this is your right kidney. This is your hepatorenal pouch area. You can see there is no fluid. Fluid looks jet black or anechoic on ultrasound. There is no fluid in this case. But can you see this? This is the liver. This is the right kidney. Can you see this clear anechoic fluid here in the hepatorenal pouch? So what is this? Fast, positive or negative? This is fast, positive. This is a fast, positive scan. Similarly, this is liver, this is right kidney. Can you see this rim? This is a thin fluid present here, black anechoic. Again, this is fast, positive scan. So this is how fast, positive looks like, means there is presence of free fluid. Look at similarly left side, this is spleen, this is left kidney, normal. There is no fluid in the perisplenic view. Then if you look at the subxiphoid view, this is your heart and this is your pericardium. You can see that there is some amount of pericardial effusion here. So this is to show you subxiphoid view or the pericardial view, positive or negative. Similarly, if you do a suprapelvic view, suprapubic view, keep it in the bladder region. This is a urinary bladder, uterus, and you can see there is free fluid in the pelvis. So free fluid in the pelvis in a blunt trauma abdomen case, you will indicate that this is a fast, positive case. Clear? What are the limitations of fast? Very, very important. Which injuries fast cannot assess? First, retroperitoneal injuries. Remember that. Hollow viscous injuries. Again, the bowel injuries are not being able, because bowel injury will lead to a lot of gas in the abdomen, and new air is enemy of ultrasound. So that is one thing that you can miss. Okay. Hollow viscous means bowel injuries. Retroperitoneal injuries can be missed. Third, blunt mesenteric injuries can be missed. Very, very important. Most of the times mesentery is injured and there is a lot of hemoperitoneum, but you are not able to find out why is it there. So blunt mesenteric injuries can be missed. Isolated penetrating abdominal injuries and injuries to the diaphragm. These are the injuries which the fast cannot assess. Okay. What are false positives? There is fluid in the abdominal cavity, but it is not because of the trauma. It could be because of any other ascites, any other cause. Okay, the patient is having a ventricular peritoneal shunt outflow. Okay, then third, this could be a ovarian cyst rupture, ascites because of any cause, ventricular peritoneal shunt outflow hai patient pass. Then third is ovarian cyst has ruptured, ovarian hyperstimulation syndrome. So any other cause of fluid in the abdominal cavity which is not because of trauma is a false positive case. False negative, the patient is having fluid but you're not able to assess. Obesity. Obesity is again a problematic thing for doing ultrasound. Lot of subcutaneous emphysema. Again, air is an enemy of ultrasound. The ultrasound waves will not be able to penetrate only into the abdomen. These are false negative causes of FAST. So here again we take another 2 minutes break and we'll continue from here further.